Hey guys, this is Dr. Hub. Today we'll look at the endemic cretinism and its types. So the first type is the neurological type. So here there is goiter. So it shows presence of the goiter and it is euthyroid. Next is there can be intellectual disability. So there can be presence of the intellectual disability and there can also be presence of the deaf mutism. There can be presence of the deaf mutism and there is presence of the squint and the proximal spasticity and rigidity. The proximal spasticity and the rigidity is present. Next is there is a normal pubertal development. This is all in terms of the neurological type. So there is a normal pubertal development and also the adult stature. So now we move on to the mixed sedimentous type. Mixed edematous. So under mixed edematous, previously in neurological there was goiter. Here there is no goiter. So there is no goiter. That is, the USG shows thyroid atrophy. So the USG, if you see, it shows the thyroid atrophy. Next we look at the euthyroid. So in mixed edematous, in neurological it was euthyroid, whereas here it is permanent hypothyroid. So in mixed edematous type there is permanent hypothyroidism. Then what are the other features? There is, in mixed edematous type, there is presence of the intellectual disability. There is intellectual disability and there is also deafness. So as intellectual disability, there is presence of deafness, there is coarse facial features, as well as the presence of the mixed edema. Whereas in neurological it was intellectual disability, deafness, mutism, squint and proximal spasticity and the rigidity. Then when you're looking at mixed edematous type, there is a delayed skeletal maturation. So there is delayed skeletal maturation. Delayed skeletal maturation and the sexual development. And there is also severe short stature. There is severe short stature.